Now that we've located the vein and made a mark so we don't forget where it's located, we're going to take off the tourniquet and give our patient a minute just to kind of, not have the tourniquet on them. It is, again, very uncomfortable to have this tourniquet on. After a minute, you're going to put on the tourniquet, making sure it's very, very tight so that you could see the vein. You're going to locate the vein again by palpating it and seeing it. And once you locate it, we're going to clean the area. So I like to clean it with the chlorhexidine first. I'm using an up and down motion, making sure to put a lot of friction so that I know this area is going to be very, very clean before inserting the needle. I also like to clean it with some alcohol as well. Again, an up and down motion. An up and down motion, making sure that this area is clean. I'm going to let the alcohol and chlorhexidine dry off. Now I'm going to make sure I have all my tools readily available right next to the arm. I'm going to take my angiocath. I'm going to remove the cover. I'm going to twist this one more time just to make sure it's ready to go. I'm going to hold the patient's arm down, anchor the vein down with my thumb. I'm going to approach with a 30-degree angle. And this is all about finesse. You're going to slowly insert the needle, and then you're going to wait for blood return. Now, great. Now that you have blood return, I suggest you take a gauze. You're going to put it under here, just to catch any extra blood that kind of drips out. Next, once you have blood return, the first thing that you should think about is making this angiocath parallel to the skin. And then you're going to advance by 2 millimeters because, again, we want to make sure that both the needle and the catheter are inside the patient. Once you advance, you should be able to easily advance the catheter into the vein by slowly doing this. And again, all about finesse, no need to rush. And great, your angiocath is in. Now, I like to leave the needle in just like that for a little bit while I'm getting the IV tubing. I'm going to remove the cap by simply going like this. I'm going to withdraw the needle by pressing this white button. Now, to make sure no blood's going to splatter in my face when the needle is withdrawn, I have my thumb over the white button. I cover and I press the white button. Now the needle is out. We have some good blood return. I'm going to attach the IV tubing by twisting onto the angiocath. And now we're all set. I'm just going to remove this gauze to make it a little bit cleaner. I'm going to clean the area. And now we have IV access, which is great. Now, how do we know we have great IV access? You're going to flush, and there should be no resistance. So flushing, and there's no resistance. And if we withdraw blood, we should be able to. And if we pull back on the syringe, we see that there's blood return. That's how we know the IV is in. So now we're just going to flush their blood back into their vein. We're going to leave this to the side. We're going to clamp this so the blood stays in the patient's arm. I'm going to remove this. Thanks for watching, guys. Please make sure to sign the attendance sheet in the description section below. Check out my other videos and subscribe, and I'll see you later.